I wish I could be more eloquent or sugarcoat this or say it in a polite way. Things are unbelievably bad. They are much worse than they've been at any point during this pandemic. And we're going in the wrong direction. So it is absolutely critical that we take action now as individuals. And I want to be clear about this, and I'll say more about it at the end. But I want to be clear about this. Don't wait for the government to tell you what to do. Do the right thing now. And that means doing all the things that we've been doing. Keep your physical distance. Wash your hands. Wear a mask. It means get your flu shot so that you can at least avoid that strain on the healthcare system. But it also means right now, it's time to collapse your bubble. It's time to be with fewer people. The Premier has told us you shouldn't have anybody in your house who doesn't live there or is providing an essential service like a personal care worker. Beyond that, you shouldn't have anybody else in your house. I want you to remember what we've been talking about since the very beginning. Clean hands, clear heads, open hearts. Clear heads means make every decision with a COVID filter. It means ask yourself, do I need to do this? Can I delay this activity? Can I do this in a different way that is safer? And can I do my part to protect myself, my family, and my community? And that personal action, I think, is really critical for us to think about.
As you heard yesterday, today we begin a 2-week mandatory period to try and drive numbers down. A few of those measures are in place for a few weeks, but of course some will stay on. I want to talk about that duration a little bit later. One measure is to ban alcohol sales in restaurants and bars and lounges after 10 p.m. and the requirement for those establishments to close after 11 p.m. We know that coming out of this, that there'll be some enforcement actions that may be required for those that don't cooperate with those requirements. The other measures include a mandatory ban on indoor group fitness classes and performance activities like singing, dancing, and theater. Team sports are also banned for 2 weeks, with the exception of semi-professional level sports that have additional measures already put in place. Individual fitness, training, and equipment use is still acceptable under the provincial guidelines, and we know that the impact on fitness has an impact on our collective mental health. I can say to you, though, the absolute best place to go work out is to get outside, have a good walk, a good run, whatever it might be. I actually asked that a letter be drafted last night to encourage our provincial politicians to allow our Calgary police officers to play a role in the enforcement of the most recent changes. And I'm optimistic that our provincial government will provide that capacity as we had previously.
Right now, the city has essentially zero enforcement power, just under the terms of how this works with the province. Public Health has suggested that municipalities can request that power. I believe we should. I've got women and men out there with uniforms and ticket books who currently cannot write tickets. And I think that if there are people who are egregiously and flagrantly putting others at risk, they ought to get a ticket. They ought to be see the consequences of the work they do. But the conversations we've had with the academics have really highlighted that the number one biggest, most important thing we can do right now is massively ramp up the contact tracing. And I mean double, triple, quadruple, quintuple the number of people who are doing it. And at a point where we've got high unemployment, where people are looking for something to do, this is not a job that requires a ton of upfront training. You don't need healthcare experience in order to do it. Probably the single most important intervention we can do is get people working there. And the City of Calgary would be very happy to partner with the province and industry, particularly companies that have people on temporary layoff. We can use the emergency wage subsidy that the federal government is offering and get those people working contact tracing. And that should be happening starting now.